Greetings and welcome to another episode on Oral Pathology 360, the channel dedicated to promoting the diagnostic sciences of dentistry. I'm Dr. Mandana Donahue, founder of Oral Pathology 360. Now, normally at this time, the beginning of every program, I tell you all what's new and what's happening and what's coming up. And for that, we have some very interesting news, but you got to hang up till the end of the program to see all that. Now, coming to today's program, today we have how to identify heart tissues. We know, of course, within dentistry, we have a lot of heart tissues, and it is one of the most important things remembering how to identify those. And sometimes it's not as easy as it seems because they can look alike and it's not very easy to differentiate all of them. So today we have a special stain, a modified Gallego stain in our technology session. It's a short lecture by Dr. Sandhya and Mrs. Rajeshri. Now, we all know Professor Sandhya. She has been with us before. She is working at DY Patil Dental College, Navi Mumbai. She is one of the most innovative people I know. She is involved in a number of things. She has a number of awards. She has very high performing research. She has a YouTube channel dedicated to carving, which has very good following. She has quite a few, I think, patents and copyrights. She has done work on 3D images and 3D animation of oral mucosal lesions, and generally, all in all, an all rounder who's always there and who does some very interesting work. And you can go to her channel after this because it is one of the channels that our channel follows, and so you can find it in our list of channels. We also have with us Mrs. Rajesh Sridhare. Now, she is the technician, the senior technician of the same department, and she's done a lot of work. She does a lot of the staining and the techniques used for the postgraduates and PhD students' work, and of course, for the diagnostic work of the department. Now, we know just how much of an important pillar to every pathology department or an oral pathology department our technicians are. We really couldn't do without them. And today also we cannot do without her. She is here with us to be able to answer any questions you may have on the technique. And with that, let me just bring them on so you can just say hi. Yes, welcome, Sandhya, and welcome, Mrs. Rajeshri.
Hello, good morning, Mandana, and hello, everyone.
Hello, good morning, madam, and hello to
Good
everyone.
morning. Hello, thank you. Okay, with that very short hello, now we shall go on. We will listen and watch the lecture and then we will come back for the discussion.
A very good morning to one and all. This presentation is coming from my Department of Oral Pathology, D.Y. Patil University, School of Dentistry, Navi Mumbai. So let us see how we started this stain. So basically in 2011, there was a national conference and PGs came and asked like what topic we should choose. So Dr. Avinash said everyone should take up a new stain or a stain already existing and make it something new. So two PGs came up with a article which was Gallego stain, and it was on some stain for heart tissues. So we tried staining and we got a wonderful results. So this is how we started modified Gallego stain. Let's see in detail. So heart tissue formation is a frequent finding in odontogenic lesions. Sometimes it's a challenge to properly identify them. H&E stains sometimes can't differentiate heart tissues such as cementum, dentine, bone, and enamel. Additionally, they need to be decalcified before staining them. Modified Gallego stain is the only stain which can be successfully used to differentiate various types of oral heart tissues using not only decalcified soft tissue frozen but also in ground section, which has rarely been reported in the literature. So, as per literature, there are various stains for heart tissues, but they don't stain all the components of a tooth or heart tissues. So, modified Gallego stain, what is modified Gallego stain? It's a variant of Lilly stain that uses basic reagents like
Dr. Sandhya,
hematoxylin, carbolfuchsin,
you can
aniline
just
blue,
turn on the
which
sound
clearly
on that live
differentiate heart
preview.
tissues. It has been tried in various normal tissues and pathologies to analyze heart tissue. So let us see the review of literature. So first the time the stain was used by Gallego in 1919. Then Lilly's modification on Gallego stain, Gallego's iron fuchsia stain was reported. Then Lilly, German and Langeran modified again the stain because this stain was used only for elastic fibers and reticulin fibers. Then Robert Lilly in 1956 mentioned that uh, um, um, reported his findings, and his finding was a little different from the earlier researchers as far as composition is concerned. And he stated that these are the exact words from his article. And he stated that in the classroom, it could be used advantageously in orienting beginning students in dental histology and in differentiating cementum portion of the calcified odontomes. I have not changed the words. This is exactly what he has mentioned. So basically, he wanted to say, like in future, if anybody wants to repeat my stain, it should be used in uh, odontomas, and he used in tooth tissues and bone. So this is the procedure, like deparaffinizing 2 changes of xylene, stain in hematoxylin for 8 to 12 minutes, rinse in distilled water, sensitized in mordant for 2 minutes, rinse in distilled water again, stain with carbol for 5 minutes, rinse in distilled water, sensitized in mordant in 1 to 2 minutes, stain with aniline blue saturated with picric acid, and rinse in distilled water and mount in DPX. And the interpretation is cementum gives red color and dentin and bone is green in color. And this is the first 1919 article where they have used for elastic fibers and reticulin fibers in the stroma. So initially it was a connective tissue stain, and later on the researchers used it in uh, tooth. So this is the very important slide. So this is the Robert Levy article which I have mentioned, his statement. So this was done in 1956. So what he did was he used for tooth, in which you can see D for dentine, C for cementum, periodontal membrane. It was then called as periodontal membrane, bone, and cementum, and this is a dentine, bone. And those days colored photography was not available, so black and white images were there. And we published in 2011. So 1956 we took this challenge, like to stain odontomas, and in 2011 we did the staining in two. This was our first publication on Gallego. So this is the article which we published in 2011, and we stained tooth and various odontogenic lesion, and we got wonderful results. So this is an AOT, and these are the tooth and bone sections giving all the colorful results, and these are the various other odontogenic tissues stained with Gallego stain, modified Gallego stain. And this is what we got, odontoma, beautiful picture of odontoma, all red globules are cementum and interspersed in the dentine. Also in forensic odontology, this is my suggestion or a hypothesis. We can use in forensic also, where the tooth are totally fragmented, not in place, the fragments are not in place, and if you want to do any forensic investigation as well as gender and age evaluation, so we can use and identify and do the evaluation. Then after that, successfully um, using this stain in olentomas, we took this topic as a thesis topic. I've given this topic as a thesis topic to my student as a dental follicle. So So what we did was we collected all the asymptomatic dental follicle around the disimpacted tooth, and what we found was what we did was we measured dental follicle width and saw the epithelial lining and stroma, any changes in the stroma, even though the follicles are asymptomatic. So we found various types of histological mm, features, like sometimes odontogenic islands were seen, epithelium was showing odontogenic changes, and in the stroma some calcifications, and we could identify the nature of the calcification. So these are the asymptomatic dental follicle showing some odontogenic tissues, odontogenic islands. Then one more one more thesis topic my PG student took on fibroosseous lesions. So in that, like this, in under HNE, lot of bone formation, and we confirmed the nature using Gallego stain. So it appears green in color, so it's bone. This was semomatoid juvenile ossifying fibroma, and we confirmed the nature of the calcification using Gallego, and this first appears like cementum, but when we saw under after staining with Gallego, it was green in color, so it was not cementum, it was bone. So this is all about modified Gallego stain for heart tissues, and I would like to thank Dr. Chandni Srivastav and Dr. Ravi Satishan, my PGs. I always say they are the pioneer for this stain, and unfortunately we lost Dr. Chandni Srivastav during COVID, but I feel she is with us because she used to answer all the queries raised by many PG students from various colleges. I've saved those messages. If any query comes, I forward this message, her messages to them. And also, I would like to thank Mandana for giving us opportunity to me and our lab senior lab technician, Dr. Rajeshri Tahale. So with this, I would like to uh, conclude my presentation by saying that Gallego stain could be considered as a practical tool in diagnosis, not only in soft tissue decalcified frozen, but also in ground section. So with this, I would like to conclude and thank you so much. Let us see the queries in the chat box. Thank you, Mandana. Thank you for everything. These are the references.
Uh, Thank you, Dr. Sandhya, for that nice presentation that you put up. Thank you so much. Now we are open to questions. Anyone has any questions, you can let us know. First, let's just see who else is here. So we have Dr. Varun. Good morning, Dr. Varun. I hope you enjoyed the conference. We have Dr. Nasser from the US. Very nice to have you with us. And it is late at night there. So thank you for joining us. We have Dr. Shruti, who is saying happy OP Tuesdays. Yes, thank you. It's always happy because I get to be with you all. And Dr. Saurabh, best of luck, Sandhya ma'am and Rajeshri ma'am. Yeah, both of you are gems in the oral pathology. Rajeshri ma'am, you have mastered staining. Wow, that's nice. Okay. And good morning, Dr. Garima, and good morning, Dr. Afrin. Yes. So I don't know, do we have any questions anywhere? And let me see. So actually, I had one question, and how much does this stain cost?
Uh, Madam, this train is actually very reasonable. It costs approximately 1,000 rupees.
1,000 rupees. That is for doing one set, or you will have leftover stain.
So, whole stay, full set stay.
Okay. Okay. Because like how when we make, say, HNE or all the other stains, inevitably you have a sufficient stain to do many, many slides and not just one set of slides. So this also must be the same. You will be able to do numerous slides, I guess, with the same stain. Yeah,
Yes.
it's very interesting actually, and I also like that you were using it for fibroosseous lesions. I know you did mostly on odontogenic was your focus, but even the fibroosseous lesions, it was interesting. I guess, especially in things like, where we have a different difficulty identifying cementum. Although now there's always this thing that it is just calcification, but it's interesting to know that we can actually, do this. And how long does the whole stain take? The whole procedure? How many hours or
It is actually very simple procedure. It takes hardly 30 minutes.
30 minutes? Okay, that's shorter than HNE. Well, shorter than HNE. Right. So I think maybe we have something on the social. Let's look. Okay, Dr. Ratu has joined us from Fiji. Hi. And Dr. Nasser is saying, very nice work. Any comments regarding mature bone versus osteoid and its reliability in such a case?
Yes, madam. We can use in both type of bones, mature bone as well as osteoid. So in fibroosseous lesion, one thesis when we did know, madam. So one hypothesis we mentioned in that article, it also states the grade of calcification because mature bone will be little highly calcified and osteoid will be little less. So in some calcifications, no, Vandana, there was green, but osteoid was showing little reddish in color because the grade of calcification is closer to cementum, right? So then we mentioned this hypothesis. It could be due to this Gallego stain gives the grade of calcification also. Hope I'm
It's
very
true.
clear.
Yes, you are. You are. Very nice. Yes. Okay, Dr. Garima. Any utility to identify osteoid in osteosarcoma? Yeah, I guess it would, but yes, you can. Go ahead.
Yes, madam. We can use in osteosarcoma also. We have not tried, but good suggestion. We can try. Thank you,
True.
Dr. Garima.
And so, have you had any particular problems with the stain and how to overcome them? Any advice you can have for those who want to use the stain?
Most of the time, cementum is not picking up the red color. So you have to change the carbamazepine. You have to use fresh carbamazepine and not diluted one, strong carbamazepine.
Okay. So there we have the how to also right now itself. And any more questions? I don't really see any more questions anywhere. Yes, this was right. No, on none of the screens is there anything happening anywhere. So I think we have kind of covered everything. And let's go back and okay, there seems to be one coming in, but which hasn't come here as yet. Okay, now it has come. Dr. Afrin is asking, can it differentiate between fibrous dysplasia and ossifying fibroma?
So, madam, we have not still used in these two lesions. Maybe we can try and we see.
True. It will be interesting. Yes. We
Yeah.
can maybe collect a number of lesions from different departments
Yes.
and do it together. It will be nice
Good
because then you
suggestion.
will have enough cases.
Thank you, Dr. Afri, for the suggestion.
Okay. So, right. I guess we wrap up. This was meant to be a short one. So, let me give you your certificates. Right. Thank you, my dear Sandhya. As always, great. Thank you. It was nice to watch and nice to hear, and always great to get a chance. Additionally, it's a side what I would say another additional benefit or what I enjoy is that I get to interact with you and spend time with you at the background of organizing things. It's always nice. Thank you so much.
Thank you, Mandana. Thank you
Thank
so
you,
much.
madam.
Yes, and Mrs. Rajeshri, for your many years of service, without which I think no oral pathologist can really manage. So, thank you so much, and thank you. I think on behalf of all the students and everybody that you have helped, and also, of course, for being here today with this presentation. Thank you so much.
Thank you, madam, for giving me such an opportunity.
You're most welcome. Our pleasure. Right. So, I had. Promised that you will have to wait till the end to see what's happening on Oral Pathology 360, the new things that are happening. So let's do that. So here is the OP360 news that you can't or rather shouldn't miss. There's the master class, then there's a free 6-month social media leadership training, and ways that you can help us with finances and content. Coming to the masterclass, it's time to take your histopathology skills to the next level by joining our 3-hour masterclass. It's jointly organized by Oral Pathology 360 and Vishnu Dental College. The session will cover everything from histologic features of benign and malignant lesions to how to use immunohistochemical, molecular, and ancillary laboratory tests to render diagnosis more accurately in all major categories of head and neck pathology: salivary, sinonasal, metastatic disease, thyroid, parathyroid, soft tissue pathology, updates in solid organ and neuroendocrine tumors, and even a brief discussion of lymphoma classification. You will also learn how to engage other healthcare providers in rendering quality healthcare for patients with better outcomes. And best of all, it's online. You don't have to worry about travel or being able to attend from anywhere in the world. Just register today. It's easy enough to reach the registration page by coming back to this section and hitting pause to scan the QR code, or checking the description below the video for the link, or even going to our website oralpathology360.com and checking the events for the masterclass, which is scheduled for the 8th of December. Time is 5:30 to 8:30 p.m. India. However, you can look up the time in your region on the page's time widget. Now remember, the seats are limited, so if you are interested, get on with it. Next, coming to the second important bit of news. Now, the free training in social media leadership. Two meritorious and lucky applicants will get the opportunity to interact with experts, take part in the organization and promotion of our events, and be a part of the Oral Pathology 360 team for 6 months. The application will close on the 30th of November. Now, we have already had a lot of interest in this and an amazing number of applications. So, if you are interested, don't wait. Again, you can apply by actually the same way that it was before. Either scan the QR code, check the video description, or visit the website. Last but not the least, there are now many ways you can contribute to Oral Pathology 360 and help us in our movement. Can help financially by personal contribution, or that is through the website, or even here on the videos through the super thanks and the super chat options. Or you can help through sponsorship of lectures or the newsletter, or by sharing your events on our calendar at a minimal cost. You can also contribute by suggesting topics or expert speakers, and definitely by spreading the word about the content and interacting with the content through liking, commenting, and sharing, subscribing, following, everything that goes on with the social media. Again, for all of this, you can just find the details through the QR code, the video description, or visiting the website. Now, if you still have any difficulty in getting to the relevant pages or finding your way around, you can message me. Yeah, most of you already know where all to find me. And mostly it is Mandana Donahue at wherever it's on, LinkedIn or all the social media, frankly. Or then you can just send an email info at oralpathology360.com and we will get back to you. Now, moving on with what we have lined up for you next Tuesday. Next Tuesday, we have a molecular diagnostic methods, mostly for students. It's going to be a rapid go through of all the advanced techniques by Dr. Uh, Divya Upala. And I do hope you will join us as usual. It will be interesting, and you can also share it with your students, residents, and I think they will also find it very interesting. With that, and I have to say, well, thank you for watching. Thank you for being with us, and we shall meet again next week. Till then, let's say bye. Bye, everyone.